Hi, my name is Justin Kowalczyk. I'm founder CEO of MedBridge. MedBridge's core mission is to improve patient outcomes and clinical excellence. What we're facing in terms of a problem that we're solving is the landscape of healthcare is changing dramatically. Maybe not a lot of you are aware of what's happening in terms of the cost controls happening in the healthcare arena, but really what we're doing is translating for what's called a fee-for-service-based approach, where providers, hospitals, private practices are being reimbursed for activities they perform versus where we're getting to, which is called value-based care, which is actually where hospitals and private practices are being reimbursed for their outcomes, which means actual patient care, the quality of the care that's being provided is being measured, outcomes in terms of amount of time and percentage actually improved is being measured. Medicare, obviously the largest insurance company in the U.S. is driving this. And in terms of the amount of money at stake here, in terms of our hospital, private practice clients that are really focused on this, is roughly $276 billion is transitioning from the older approach of fee-based services to value-based care. There's a lot of money at stake. This understates it by billions simply because this only includes Medicare and Medicaid and none of the private practices. So for our clients, hospitals, skilled nursing facilities, home health, private practices, and surgery centers, for any medical provider, this transition to an outcomes-based approach isn't a matter of a nice to have, it's a matter of financial survival and viability. So what's MedBridge? We're a cloud-based SaaS platform that solves the biggest challenges in this environment. We believe that high-quality, evidence-based education is a really strong solution to solve for this problem. We focus on both clinicians and on patients. And the reason for that is we help patients actually be more engaged in their own healthcare activities and to become active participants. For clinicians, we actually engage them on multiple levels. We give them new clinical skills, as well as we provide them the opportunity to advance their career, as well as we help hospitals and other large practices and institutions to continue to retain the top talent. In terms of how we built our program, we first partnered with a Harvard professor of education, Dr. Stone Weisky, brilliant woman, who helped us build out a cognitive and experiential learning approach. On top of that, and we continued to take into account short-term attention spans of learners, having high-quality 3D models to explain very difficult pathological illustrations, as well as motion graphics, multiple camera angles, symptomatic patients, really making sure that we're engaging each of our clinicians as well as patients in the most effective manner. What we're trying to do here is take the latest evidence and research and translate it as quickly as possible into a clinically practical and applicable manner on a daily basis. This means we need to change behavior on a daily basis, which is difficult to do. Not only do we produce a very high quality product in terms of our content, we're very big into platform. For our clinicians, we actually provide them the opportunity to identify where their weak points are in terms of skill set, in addition to where they're strong. And this allows us to provide a sophisticated learning management system that basically assigns them, as you can see on the left-hand side, this is a screenshot of our LMS, basically allow them to be targeted specific courses to help them improve their skill sets. On the right-hand side, though, is just kind of a quick overview of an outcome system. We're able to actually provide outcomes reporting at the hospital, clinic, and individual clinician level. And if you're able to do that, then you're actually able to identify which care regions, which areas that individual clinician is performing well in and not performing well in. And that means that we can, via our LMS, actually assign targeted education to improve gaps in performance. What this means is that, by the way, our LMS integrates with other LMSs, HR systems, so we actually work with some of the largest hospitals in the US. What this allows us to make sure is that we're providing the top skills for each of the clinicians in the market so they can actually improve patient care. We also take our high quality production and our platform production and apply it to individual patients as well. This means that what we're doing is making patients active participants in their own health care. And we've even looked at all the different exercise apps that are out there. We've actually started to look into, well, actually, we should actually have for doctors and physicians their own ability to produce and actually white label a patient-facing app that lets them further engage their patients and change behavior on a daily basis. Behavior doesn't change from one doctor visit to another. Actually, it changes from on a daily basis, and this product actually does that. In terms of MedBridge as a company, we're kind of combined between two different factors. One is we're 50% content, and the other one is we're 50% platform. This allows us to control our content production. We have one of the largest video production studios in the Northwest. We produce about 60 courses per month, and by August of this year, we'll be producing about 90 courses per month. These are clinical courses. In addition, we also provide for business as well as compliance courses to make sure that we're covering every need for our hospitals, private practices, surgery centers, home health, and skilled nursing facilities. In terms of the other products that we produce, it keeps continuing. We just launched a new marketing platform that allows for using our high-quality education products to engage patients during the episode of care as well as through post-discharge. Beyond that, we've also just launched our first Net Promoter Score service. In addition, is the outcomes and tracking system. So in terms of what are we trying to accomplish over the short term and midterm is for both patients and for our proprietary our enterprise clients is we want to make sure that via our quality content and our quality platform that we're actually providing the right mix and making sure that we're improving outcomes, getting away from the fee-based system towards a more value-based care approach, but at the same time that we're making sure that our hospitals, private practices are not losing out as a transition towards value-based care occurs. So this is working. One case study, we've got many of these. 6-month study period of use of MedBridge, 100% staff retention rate, almost a 20% increase in outcomes, and a 15% reduction in cancellations and no-shows. By the way, we are bootstrapped, so we won the Bootstrapper Year of the Award. We're based out of Seattle, so it's GeekWire. And we were number 7 in Seattle in terms of top growth on Inc. 500. We've grown about 1,500% over the last 4 years. Over 1,000 organizations use MedBridge, some of the largest hospitals in the nation. We have about 10% of our clients are international and growing. Over 2.5 million patients use MedBridge, and that's growing about 5% per week. So we're very excited about the future for MedBridge. And thank you very much.